Hi again, welcome back, and in this short lecture we'll just look at the path of sperm leaving the body during ejaculation. So, first slide should be review. We will start in the testes. Actually, we'll start in the epididymis. That's where the sperm are stored, is in the epididymis. They're not really stored in the testes. They move out of the testes into the epididymis. And so they're stored in the epididymis and in the vas. Which is, did they label it? Well, we'll label it now. Vas deferens, again for sperm storage, in addition to just being the duct, but sperm are stored in it. Reminds me of a joke. I don't normally do this, particularly when it's recorded, but what's the difference between a male and a female? And the answer, of course, is, well, it's a vas deferens. So, yuck, yuck. Okay, so again, the pathway, you should be able to describe this in sequence. It leaves the epididymis. So maybe we'll just put a number 1 goes into the vas, and then it is propelled along through the vas by peristaltic action during ejaculation. The smooth muscle contracts in waves, and then the sperm and then the fluid from the testes and the epididymis mixes with fluid from the seminal vesicles. So those mix here, and then we go through a short ejaculatory duct, which is the joint section from where the vas merges with the seminal vesicle to the prostatic urethra, and this, of course, is the prostate gland, and the urethra passes through the middle of it. So this is the reason sometimes in males, when they get elderly and the prostate gland grows benignly, it can compress the urethra, and then the male has trouble voiding urine out of the bladder because it has to pass through this compressed prostate gland, which oftentimes enlarges rather normally in males. Well, then the sperm continues on its way out of the body, joins in with the urethra again, and here it mixes with the fluid from the bulbourethral glands. I'll talk about the different glands and the different fluids in the next slide, but this is sort of doing the anatomy. So there are these two small bulbourethral glands that make bulbourethral fluid, and that flows through a duct in the spongy portion of the erectile tissue of the penis, merges with the urethra again, and then the sperm continue passing out of the urethra through the penis. So that's the basic path. And there we'll go to these different vesicles and glands next. So we had the bulbourethral gland, had the seminal vesicle, and we had the prostate gland. So those are the three to watch for. And again, you should be able to identify those on a drawing such as this. So, next slide, I wrote some of this out. ejaculation, male orgasm, smooth muscle contractions, and these are controlled by the sympathetic nervous system. This is ejaculation, pushing sperm out of the body. It's autonomic. Autonomic goes to smooth muscle, cardiac muscle, and glands. So here we're dealing with glands and the smooth muscle of the vas and the epididymis. So the smooth muscle contracts, propels sperm along by peristalsis, as I mentioned, mixes fluid from the seminal vesicles. And the seminal vesicles contribute fructose to the semen for ATP production by the mitochondria on the midpiece of the sperm. And after the seminal vesicles contribute the fluid, the semen passes and flows through the prostate gland, where the prostate gland contributes fluid also to the semen, and part of what's in the prostate gland are hormones and other factors that promote swimming. So at this point, the sperm are activated and able to swim once inside or outside of the body or in the female reproductive tract. The bulbourethral glands are sometimes referred to as pre-ejaculatory. There's a small amount of fluid that is released from the bulbourethral glands prior to ejaculation, and that is sort of thought to act as sort of a urethral cleanup. Neutralizes any urine that may be left over. And it also lubricates the urethra for the passage of sperm. This is not lubrication for intercourse. This is just lubrication of the urethra for the passage of sperm. So they're not all ground up on the rough edges of the urethra as they're ejaculating. The semen components, the testes, contribute about 10% of the volume. The volume is a couple mils, typically. And there are several 100 million sperm in each ejaculation on average. And the seminal vesicles contribute about 60% of the volume, and the prostate gland about 30%. And so all that adds up to a couple of mils of semen. And that's enough of that. So, next topic, we'll consider the penis.